Hello everyone. Now in this video I will be discussing about the history taking of the cough. So before we start, firstly we have to introduce ourselves to the patient. While at the start of the history taking, when a patient tells you that he or she has a cough, we have to ask the patient along with the cough anything else that is bothering you, okay? And for how long time you have a cough? Is this developed suddenly or gradually? Is this occurs occasionally or it is persistent? Okay. Is this seasonal? And at which time of the day cough usually starts? Is there any particular time of the day when the cough gets worse? And we have to ask what is the character of the cough? And have you noticed any change in the character of the cough over time? Okay, or it is same as before. Have you noticed any change in the quality of the voice over time? And how cough is aggravated, how cough is relieved, and is this productive or dry type of cough? If the cough is productive, we have to ask the further questions like what is the amount of the sputum and what is the color and the odor of the sputum. And we have to ask the patient like, can you tell me at which time of the day excessive sputum production occurs? And is there any relation between the sputum production with the posture? And is there any blood in the sputum? And do you feel shortness of breath? If the patient says yes, he has a shortness of breath, we have to ask the further questions like how far can you walk before your breathing stops you, and how many flights of stairs can you manage comfortably? Do you feel chest pain and any chest tightness? Okay. And do you have these, that is whistling sounds while breathing? And do you have allergies? And does any family members have the asthma? Do you smoke? Any nasal congestion? And ask the patient like if they have a nasal discharge or throat irritation. And is there any heartburn or pain? And do you feel retrosternal burning on lying down? And have you noticed a weight loss? Do you have fever and night sweats? Is there any family history of lung cancer or tuberculosis? And is there any rash on your body and any lumps in your body? And you have to ask the patient, can you tell me about the nature of your job? And do you have pets and birds at your home? If yes, who will manage and handle them? And what medications you are using before the development of the cough? And do you have hypertension or diabetes? And have you traveled before the development of the cough? And currently what medications you are taking, and which type of inhaler, and how many times you are taking? And we have to ask the patient, can you tell me about the impact of the disease on his or her life? Okay. And can you perform your daily activities easily, yes or no? And can you sleep comfortably or not?